Hello, I'm Professor Oleksii Kalmykov, MD, DMed Sci. You may have seen headlines like, "New research says seniors need one blood test in 2026, and it's not cholesterol." That test is often claimed to be a hormone called irisin. Let's put this into a calm, evidence-based frame. Irisin is a signaling molecule linked to muscle activity. Researchers are studying whether it reflects aspects of muscle health and metabolism. But right now, irisin is not a routine, guideline-recommended blood test for older adults. And the test itself has practical limitations. Different lab methods can produce different results, and there are no widely accepted clinical cutoffs. So the responsible message is this: irisin is interesting science. It is not a must-have screening test. What should seniors focus on instead? The most evidence-based upstream strategy for healthy aging is not a single biomarker. It is maintaining physical function, strength, balance, and aerobic capacity. That means a weekly routine that includes 3 elements. First, regular aerobic activity, like walking. Second, muscle strengthening activity on at least 2 days per week. Third, balance-focused activity, because falls are one of the biggest preventable risks in older age. If you've heard walking is not enough, here is the more accurate statement. Walking is beneficial for the heart, mood, sleep, and mobility. But many older adults do better when walking is combined with safe strengthening and balance work. Now I'll share examples, not personal medical advice. If you have chest pain, frequent dizziness, uncontrolled blood pressure, recent surgery, severe osteoporosis, or a history of falls, discuss a plan with your clinician or a physiotherapist before changing your routine. A simple senior-friendly strengthening session can include sit to stand from a stable chair, wall or counter push-ups, light pulling with a resistance band, and short balance practice while holding a countertop. Safety matters more than intensity. Use supportive shoes. Use a chair that does not roll. Clear the floor of rugs and clutter. Keep your phone nearby, and avoid breath holding during effort. Exhale as you stand or push. Now, about walking after meals. For many people, a short walk after eating can help post-meal glucose control. You don't need dramatic claims about a single hormone to benefit from this habit. If it is safe for you, try a brief, comfortable walk after your largest meal. What about cold showers? Here, I want to be very clear. Cold exposure is optional and not appropriate for many seniors. If you have angina, rhythm problems, uncontrolled blood pressure, Raynaud's, neuropathy, poor balance, or you are at risk of falling in the shower, skip it. If you are healthy and still want to try cooler water, prioritize safety, stable footing, no rushing, and stop immediately if you feel lightheaded or unwell. So where does irisin fit? Think of irisin as a research signal that may reflect muscle metabolism communication. Exercise can influence irisin on average, but study results vary and measurement issues remain. That is why the real target is not chasing a hormone number. The target is improving outcomes we can measure directly. Rising from a chair more easily, walking more steadily, carrying daily items safely, sleeping better, and reducing fall risk. If you want to discuss irisin testing with your clinician, do it this way. Ask whether the result would change any decision. Ask which lab method is used and how the result would be interpreted, and keep the focus on standard prevention, blood pressure, lipids, diabetes screening when appropriate, vaccinations, osteoporosis assessment, and a safe physical activity plan. Before we finish, the most important safety rule. Stop exercise and seek urgent medical care if you develop chest pain or pressure, severe shortness of breath, fainting, new one-sided weakness, sudden confusion, or a severe new headache. Thank you for watching. If you want more senior-safe, evidence-based explanations focused on function and prevention, follow this channel.